Chandler English with Upson Regional Medical Center, and I'm here today with nurse practitioner Candice Young. Candice is with Upson Cardiology. Candice, thank you so much for being with us today.
Yes, ma'am.
To answer the questions our Facebook followers asked a while back. So, before I ask you the questions, could you tell our followers just a little bit about yourself and your role at Upson Cardiology?
Sure. Like she said, my name is Candice Young. I am a nurse practitioner for Upson Cardiology. I started out as an RN right across the street at the hospital. I've been a nurse for about 10 years and a nurse practitioner for about 5. What I do is direct patient care over at the hospital, as well as seeing patients right here in the office.
Awesome. And the first questions that our followers ask is, when should you worry about heart palpitations?
Heart palpitations can be common. If you've had excess caffeine during the day, or if you get a little nervous about something, your heart might do little flips here and there. That's not anything to really worry about if it's occasional. You worry a little more if it becomes frequent or recurrent, or if you have associated symptoms, lightheaded spells, dizziness, chest pain, or shortness of breath when you have the palpitations.
Okay. And the next question is, what are the common symptoms of heart disease?
Okay, heart disease, if you're looking at as if you're, worried about having a heart attack or an MI, those symptoms are, with a man, they're a little bit more common.
Okay.
Chest pain, pressure in the chest with exertion. You might see a man that has pain down his arm or up into his jaw. A woman is a little bit trickier. She may have shortness of breath or overall fatigue, just out of nowhere for no reason. She might be just outside of her normal, and that's when we would say for her to get checked out.
Okay. And the next question is, if you had quadruple bypass surgery in 2008, how active should you be now?
Well, anytime you have a cardiac event with bypass surgery or a heart attack or anything of that nature, we want you to start out slow. You don't want to go in full throttle and think you can run a marathon, because
Right.
it's not going to really be good for you. So listen to your body. If your heart and your body says slow down, then that's what you need to do. About 30 minutes of exercise, just light activity, and work your way up.
Okay.
A walk in the afternoons is great.
Yes. Especially when the weather's nice.
Yes, yes.
And the last question is, a lot of us have had anxiety during the COVID-19 pandemic. How does anxiety affect your heart?
Well, anxiety, occasional anxiety, everybody gets that. Like you said, during the pandemic, we've all got a little nervous about things. So you might have an increased heart rate, or your blood pressure might go up a little bit. If it's happening often, chronic or daily anxiety, then you want to see somebody, your primary care, for example, to have that checked out. If it's just occasional, where you almost have a car accident or something like that, and it gets your nerves a little bit up, then find a quiet space, sit down, do some breathing techniques, and just calm down a little bit. It's not quite as bad.
Thank you. And thank you so much for being with us today. We greatly appreciate you answering these questions. And to make an appointment with Upson Cardiology, please call our office.